Hey guys, welcome back to the channel. This is Sai Dental Vlogs and today's topic will be how to maintain the monthly expenses of your dental clinic. जी हाँ, इस पूरे टॉपिक के बारे में डिटेल्स में बताने वाला हूँ मैं आज. And actually I was one of my juniors, he asked me this question कि sir, how do you manage the daily expenses? So I thought why not to make a video and give some information to you people. So if you are viewing this channel for the first time, I make videos on dentistry and dental related topics, and I am Dr. Abhishek Pati, Associate Professor in Department of Oral Medicine in Bhubaneswar, IDS. So whenever we open our clinic, in the initial first 1000 days of the clinic, हमको what should be our target? The main target should be to maintain the expenses of your clinic. Why? So that you don't have to shut it down. मतलब कि इजी वर्ड्स में अगर आप अपने क्लिनिक का रेंट, अपना लैब का बिल और अपने असिस्टेंट का बिल और इलेक्ट्रिक बिल निकाल लेते हैं, तब आपको क्लिनिक शट डाउन करने की जरूरत नहीं है. सपोज आपका लैब का बिल महीने का 5000 आ रहा है, मटेरियल बिल 5000 आ रहा है, 10,000 प्लस आपको क्लिनिक का रेंट अराउंड 10,000 है, 20,000 प्लस सब मिला के आपका खर्चा 25,000 आ रहा है. और आपके हाथ में बाय पेशेंट्स जितने आ रहे हैं, सपोज महीने के 7 या 8 पेशेंट्स, बहुत कम पेशेंट्स आ रहे हैं, पर उन्हीं से ही अगर आप महीने का 35 या 40 या 45,000 कमा रहे हैं, इनिशियल जो स्ट्रगलिंग फेज होता है, सो एट दैट टाइम व्हाट यू शुड डू इज यू शुड कैरी ऑन विद द क्लिनिक, बिकॉज द पेशेंट फ्लो विल स्टार्ट इंक्रीजिंग डे बाय डे, राइट? सो व्हाट आर द एक्सपेंसेस? So the basic expense what we should try to avoid in our clinic, that is whenever the patient is coming to our clinic, apart from the normal chief complaint of the patient, after solving the chief complaint of the patient, right, we have to tell the other problems also, right? Why we have to tell the other problems? We have to tell the other problems so that the patient's money is saved. Yes. Why? Because suppose a caries tooth is there and we did a filling, right, and we save the patient from like doing RCT of that particular tooth, right? So patient is saving some 6,000 7,000 rupees for that particular tooth. Now what you are doing, you are generating some extra income out of the patient, because apart from the RCT of a particular tooth, you are telling the patient to do some more amount of treatment, like filling the all other rest. So from one patient, if we check properly, if you see the oral cavity, so we can generate revenue, and we can help to increase the income of the clinic, right? दूसरी चीज ये चीज है कि the other things which we need to see is the electrical appliances which are there in our clinic. We should maintain them regularly. What we should do, suppose the apex locator is there, then different air rotors is there, the motors, so you should all get it checked properly, oil all your air rotors and cartridges, and we have to, whatever equipment, like suppose the transformer is there, you have to get it checked from an electrician whether there is any carbon accumulation or there or not. Suppose you have an inverter in your clinic, so you should check whether you are putting distilled water time and again, every 3 months you are putting distilled water and fulfilling it or not. Plus whatever ACs and whatever things are there in your clinic, you have to clean them regularly, get them serviced regularly, right? So this is the thing, you can cut down some expenses. Suppose अगर अब मेरे क्लिनिक में देखिए मैंने नया AC लगाया है, तो few days back my AC totally got damaged and I could not, since I was not maintaining it properly, it got totally damaged and I had to shell another 40,000 to buy this new AC, which you can see in the back. So एक बार में मेरे को झटका लगा 40,000 का. वो आपको मतलब कि बहुत महंगा पड़ेगा, हमको, मुझे भी बहुत महंगा पड़ रहा है, because suddenly at this COVID time shelling out so much money, and without AC you cannot sit in this hot and humid weather. So that is the thing. Suppose all your dental chairs are there, whatever equipments, compressors, you have to oil them regularly, and you have to make sure that all the work, after completing all the work, you check thoroughly your batteries, your UPS, everything, and that way you can control the damage in your clinic, and that way you can save some amount of money. So usually in my clinic the expense of lab comes around 17,000 per month, and 17 to 20,000 per month, and material bill is around 8 to 9,000 per month of both my clinics. And so this is the expense which is bound to happen, so you cannot reduce this expense, right? So what we need to do, so what I have started is now only, whenever the bill comes to me, the lab bill after every crown or after every zirconia crown, I pay him immediately. So that is the way I am saving a huge amount at a particular time during this COVID time when patients are already less. So what I am doing is, एक crown आता है, 2 crown आता है, I pay the lab technician his fees, right? So that way we can save a bulk amount to be given to the patient. And right now it is not the correct time to invest in something, because already patient flow is less, and if you are planning to buy some implant kit or RVG, just stay hold for few days or few months. Once the things get regular, once the lockdowns and all everything opens and patient flows it starts regularly, then you can plan to invest something new. Otherwise you have to give EMI and you have to bear unnecessary stress of the situation, right? So other things, what are the other expenses? Suppose regular maintenance expenses are there, like you have to buy gloves. So what things you can do to avoid these kind of unnecessary expenses? Suppose you are buying gloves, right? So if you buy one packet, it will cost you around 700 rupees. So what my suggestion is, you buy it's already required, it's a consumable item and it's always required. So what you do is you buy one carton of gloves with 30 packets. So one packet will cost you around less than that, it will cost you around 550. So for every glove packet you are saving around 70 to 80 rupees. That's not a less amount, it's a huge amount. So if you multiply into 30, so you are saving around 2400 rupees for a pair of 30 gloves. So initial cost will be more, but in the long run you are saving, right? So these ways you can save your expenses in your clinic. Now what are the other expenses through which you can save money? Suppose a patient has come to you and suppose there is a little bit of swelling, and you should not send the patient away. You try to extract the tooth on the same day or start the treatment on the same day itself. Suppose a patient is coming to you for RCT and अभी तो gloves पहन के ही सब कुछ देखना है, mask, PPE kit. So on the very first day, if you are treating the patient, the work will also will finish faster. Suppose you started a work on 1st of July, right? Then you started on the same day itself and you can finish the entire case in 10 days. So 1st July to 10 July, you have done one RCT, one crown of a particular patient. So in this way, you are reducing the number of appointments of the patient. Now I am wearing gloves, my assistant is wearing gloves, my one more assistant is also wearing gloves in the clinic all the time. So that way I am saving 10 to 11 pairs of gloves for a particular patient. So अगर आप पहले दिन आप काम स्टार्ट करेंगे तो आपका मटेरियल कम खर्चा होगा, आपकी इलेक्ट्रिसिटी कम बर्न होगी, आपका जो टाइम है वो भी कम खर्च होगा. तो try to start the work on the very same day itself. So this way you can cut down a little bit of expenses. So this amount is negligible, right? This amount, what I am telling is negligible, but in the long run it will really help you to you'll be able to do more perfect work and you'll be more confident, right? So these are few ways which you can reduce your expenses in the long run. I'm not telling कि आप कुछ भी मत खरीदो, कुछ भी invest मत खरीदो, but देख के खरीदो कि is it really required? Check, make a priority list कि which one is the first priority. So in my clinic I had to buy one implant kit also, okay, but my priority was something else, so I didn't get it now because I'm not getting that much implant patients from past 1 year because of this COVID situation. Nobody is having that much amount of money to invest. So I dropped that idea and got something else for me, RVG, second RVG, which I really wanted badly. So this, you have to set your priorities, you have to set your goals, and by that way you can reduce your expenses, and this is the way I maintain my regular expenses in my clinic. Rest and all, the main suggestion which I would like to give you is कि bill आता है तो initially amount, just don't hang to it and just pay the bill immediately. That is the best thing you can do. Pay your bills on time, that way you can save money. Don't keep the amount in your purse or in your bank. Just pay to the persons who really want it. That way you will develop a good rapport and a good trust between you and the person who has given you any material or the lab person. So today's video is all about this. If you have not subscribed to my channel, please do subscribe, and please do follow me on Instagram, Sai_dental. Till then, love you all. Take care.